Yes, I can make a nursing school video for how to know the drug classes so that you can create med flashcards. Spoiler, don't make med flashcards. Do this instead. Besides the fact that med flashcards just don't work, they're expensive if you buy somebody else's, and they're time consuming if you make your own. Instead, you need to study them using what I call the prototype method. Now, I didn't invent the prototype method, but apparently I'm like one of the only people that teaches it because I'm constantly shocked by the number of nursing students who have never heard of this. Even though a lot of you probably have the prototype method built into your textbook. Like seriously, a lot of pharmacology textbooks for nursing school, they literally write the textbook using the prototype method, and still the nursing students are never taught to study drugs this way. So here's how you use the prototype method, and I'll even tell you what kind of flashcards you could be making instead of your stereotypical med flashcards. The prototype method is where you take one medication from the drug class that you're studying and make that your prototype. It's the class president, because everybody knows the class president is chosen by popularity. It's just a popularity contest. Which medication for that drug class is most commonly used, most well-known, most popular? Because all the medications are in a drug class for a reason. It's because they're all pretty similar. They're all pretty much the same. And since you only need to be a safe, effective beginning nurse while you're in nursing school, if you know everything you need to know about that prototype method, and I don't just mean memorizing, I mean like understand using like the silver bullet study system or whatever method you like, but I like the silver bullet study system because it's easy. It's the best way I've found to have nursing students study in nursing school. Then whatever you know about that prototype can be applied to the other medications in that drug class on like test questions and stuff like that. Now, I get some flack sometimes and like some trolls in my comments who say things like, oh, well, I'm scared to work with nurses that are going to be like that and are going to study that way. I call BS. You don't have to be an expert in every single medication. Zero nurses are. Zero nurses are. And if you ever do need to become more of an expert at the nuances of drugs in between, like within a drug class, you will gain that knowledge once you go into a certain specialty area, if you need it. But you certainly don't need to be an expert to that level in every single drug class. You need to know enough to be a safe, effective beginning nurse, and more importantly, you have to know how to learn about a medication for the future so that later on, as you encounter new meds or unfamiliar meds when you are a practicing nurse, you know how to go about learning about them, researching them, and really understanding them. That's the skill you're in nursing school to learn, how to think like a nurse, and how to do research like a nurse, how to ask questions like a nurse. Not sure how to identify the prototype method? First of all, look in your textbook, see if your textbook is one that uses the prototype method, because then it would just tell you. Otherwise, ask Google. Google is great at telling you what the prototype method is. Just say, what's the prototype for this drug class? And Google will tell you pretty much. Remember, selecting the prototype is just the beginning. And I also promised to tell you when it is okay to create, med flashcards. Here is the rule. If it's a one-to-one correspondence of information, you can use flashcards. So we're going to say we memorize the drug class, and maybe if there's an ending, like that's associated with the generic names in that drug class, that would be something we could memorize because we associate it with that drug class. If we want to memorize the drug class and the prototype medication, that would be a one-to-one correspondence of information. Yeah, we can use a flashcard for that to help us memorize it. If we do the drug class or a specific medication, and everything we need to know about that medication from symptoms to, half-life to nursing care, everything, that is not a flashcard. That is brain spaghetti just waiting to happen. You're going to be overwhelmed. You're never going to keep it all straight. It's going to be useless on test day to answer test questions. So I hope that's helpful. Let me know if you guys want me to make a free resource about the prototype method, because I feel like y'all ask a lot of questions about it. That might be helpful. Leave a comment to tell me. And don't forget to give me a follow for more nursing school help.